Hello, my zebras and spoonies. Thanks for coming and hanging out with me today. I am glad that you are here. Today, I want to talk about my experience with migraines as an installment in the My Diagnosis series. I personally have two kinds of migraines. I experience abdominal migraines and migraines, headaches with aura, or classic migraine. While they are very different experiences, they are technically the same thing, and I want to talk about them together to highlight how varied the migraine experience really can be. As always, I'm going to start out by talking about what a migraine is, and then I'll get into what the two different types I experience are. The first thing to note is that this is a neurological disorder. It is not technically a type of headache. In fact, it is possible to have a migraine without having any head pain. Having a headache is one possible and very common symptom of migraines, but it isn't actually a headache disorder. So, the American Migraine Foundation defines migraine as an inherited neurological disorder that is characterized by overexcitability of specific areas of the brain. I make this point because people are often confused when I talk about abdominal migraines. When they come into the conversation thinking that migraines are a headache disorder, it can be very confusing for someone to be talking about abdominal symptoms. Many people who have migraines never have headaches. So I think it's important to keep in mind that it is a disorder that is about the overexcitation of the nervous system rather than actually being a pain disorder. Again, that's a very common symptom, but it's not a requirement to be a migraine. Just like the majority of chronic illnesses, the cause is unknown. We know that there is an overexcitability in the brain, and depending upon the part of the brain that is overexcited, it's going to dictate what symptoms a person will experience. But we don't know why this overexcitability happens. But the fact that different parts of the brain can become overexcited is why there's a vast array of variability under this umbrella of a single diagnosis. There are many different types of migraines, and the diagnosis is often layered to describe the features of the migraine that are specific to that individual. So, the first part of the migraine diagnosis is how often a person gets a migraine. And this is measured by the number of days that a person has a migraine symptoms in a month. So this can be episodic, which is 7 days or less, high frequency episodic, which is 8 to 14 days, or chronic, which is 15 or more days. I currently am in the category of being episodic for both types of migraines. Before I was receiving treatment, I was high frequency episodic for the migraines with aura, and I was chronic for the abdominal migraines. The next thing they consider for the diagnosis is whether or not you have an aura with your migraines. You can have an aura with any kind of migraine. It can be a wide range of sensations or neurological symptoms that precede or coincide with the migraine symptoms. For me, I do not get an aura for my abdominal migraines. I do get an aura with my migraine headaches. For me, the aura is a change in my vision that I can best describe as a smearing. The edges of everything become fuzzy, and when I move my eyes, there is an after image that trails behind everything, leaving a smear of color in my field of vision. This makes it impossible to drive, but there are many other tasks that I cannot perform safely when this vision change occurs, and reading is really difficult. The next thing that is considered is where you are having pain, if any. If you are having head pain, it is dubbed a headache. If the pain is in the abdomen, it is likely that you'll be diagnosed with abdominal migraines. And if you don't have any pain, you will be diagnosed with migraine without headache or silent migraine. I have abdominal migraines and migraine headaches. The last thing that they consider is if there are any classic patterns or clusters of symptoms presenting. If so, you'll be diagnosed with an additional modifier based on the symptom set or pattern that you present with. And this includes brainstem aura, hemiplegic migraine, menstrual migraine, ocular migraine, vestibular migraine, ophthalmology migraine, and I just butchered that. My migraine headaches are menstrual migraines. My abdominal migraines don't have any additional symptom sets that add a qualification to the diagnosis or a modifier. So hopefully that big long explanation makes it clear that migraines are very complex and that it's much more than just being a headache. So the full diagnosis for my two types of migraines are episodic abdominal migraines without aura and episodic menstrual migraine headaches with aura. So, as you can see, when you get a diagnosis, there are multiple pieces. They're kind of layered, they're descriptive. And the idea is that when a healthcare provider reads this diagnosis, they will get a general description of how your migraine presents. So, both migraine types suck. I can count on having a migraine 2 or 3 days every month when I'm having menstruation. My preventative medications have not prevented these migraines, but they have reduced the severity. Most of the time, I can now be functional through the symptoms if I need to be. Most of the time, I can just kind of take a max salt and I can function. I can do what needs to be done. Before being on Topamax, that was really not an option. I was out of commission when the migraine headache came. And as much as these migraines suck, the abdominal migraines are far worse for me. Partly because I hate vomiting more than I hate being in pain. Before getting onto Topamax, I was having abdominal pain with vomiting 20 to 25 days a month. It was awful. Now I have 1 or 2 days a month. For me, Topamax was completely life changing. It's not perfect. I mean, the drug has side effects, but it was life changing in a very positive way. Migraines are a complex experience that have several phases, and not every person experiences every phase of the migraine. So the first phase of the migraine is the prodrome phase, and about 77% of people who have migraines experience this phase. But there is a gender difference, with about 81% of women experiencing this phase, while only about 64% of men do. And we don't know why there's a gender difference, but it exists. So this phase usually begins a day or two before the pain, and frequent symptoms during the prodromal phase are frequent yawning, a mood change, which is most often irritability, lethargy, neck symptoms, which is usually stiffness or pain, light sensitivity, restlessness, difficulties in focusing your vision, feeling cold, food cravings, sound sensitivity, sweating, excessive energy, thirst, and edema. I do not have a prodromal phase for my abdominal migraines, but I do for my migraine headaches. But it is possible that these symptoms are because I'm getting ready to start menstruation rather than because of the migraine headache. I get irritable, I have fatigue and lethargy, I crave sugar, and I have increased difficulty focusing. But these are pretty common symptoms just of approaching menstruation. So there's no real way to be certain what's causing the symptom set. But I can say with pretty good accuracy that when this symptom set occurs, that I am going to be starting my menstruation soon and that I am likely to be having a migraine. For me, my menstruation is very irregular, so this is often my little flag that things are coming. Uh, the aura phase can precede the pain phase or can arrive simultaneously. It can include both negative and positive symptoms. So the negative symptoms include like the loss of things or a reduction of function, like losing the ability to see or having less sensation in your skin. While positive symptoms are the addition or the increase of symptoms, like seeing flashing lights or smelling something that isn't there. About 25% of people with migraines have an aura, and there doesn't seem to be a gender difference. Visual auras are the most common, with allodynia being the second most common. So I have no aura with my abdominal migraines. With my migraine headaches, I get vision changes that I've previously described that starts a few hours before the pain phase. During the pain phase, I also have allodynia, which is the experience of pain from stimuli that isn't normally painful. For most people, it is experienced on the scalp or the face, but it can be anywhere in the body. For me, it is on my scalp and in my mouth, most specifically my teeth. Eating while I have a migraine headache will absolutely make my teeth hurt. The next phase is the pain phase, which is a bit of a misnomer. It's when you have the migraine symptoms. So even if you don't have pain with your migraine, you do have this phase. This is the phase that every single person with migraine has. Some people have started referring to this phase as the migraine phase to distinguish that it does not always include pain. If you are going to experience pain, it will happen in this phase, and it will either be the headache or abdominal pain, but it's going to include a multitude of other symptoms, and those are commonly nausea, vomiting, light sensitivity, sound sensitivity, runny nose, running eyes, the pain from not normally painful stimuli, um, irritation from smelling things that aren't normally, that aren't really there. And this is also when other symptom clusters would be present if a person has them, such as those for hemiplegic or ocular migraine. During an abdominal migraine, my symptoms start sudden. I don't get the prodromal phase or the aura phase that would cue me that something's coming. It just goes right into the pain phase. And it's a throbbing, stabbing that is in time with my heartbeat. The pain is mostly in my left upper quadrant, but often radiates down into the left lower quadrant. I experience nausea and vomiting that is very intense. I will completely empty my guts and I will go into dry heaves. It is like I am trying to vomit up my toes. I feel cold and I get sweaty. I have light sensitivity and sound sensitivity. During my migraine headaches, the pain is on the right side of my face, with it being the most severe at my right eye. It feels as if someone is stabbing my eye in a throbbing fashion in time with my heartbeat. My face burns, my teeth ache, anything touching my scalp is painful. I have light sensitivity, I get nausea and vomiting, but it is not as severe as it is with my abdominal migraines. The last phase of the migraine is the postdrome phase, and this phase consists of movement vulnerable pain in the same location as the previous pain, if pain is part of your migraine. And common symptoms that people experience are exhaustion, dizziness, difficulty concentrating, and euphoria. After I have a migraine of either kind, I experience a postdrome phase that's pretty much the same. I have positional pain. Being upright means more pain for me. I'm very tired and I usually end up sleeping a prolonged period of time. I have dizziness and poor concentration, and I often feel sad and emotionally used up. Migraines are a lot of work. They eat up every spoon I have. I think that the thing that is most difficult about having migraines is the misconception that they are just headaches. When I have a migraine, I sometimes have to call out from work because I'm just not functional. And even though I am a nurse and I work with individuals who are educated on what a migraine is, there is a great deal of stigma around having migraines. And I am often seen as being lazy or work avoidant because I called out. And I have frequently gotten comments like, just take an aspirin. And this is while working in the medical field. I cannot imagine what those dealing with migraines face when they are working with, other environments. So the productivity culture in this country is toxic and it's not good for anyone. I promise you that no one wants me coming into work as their nurse when I am uncontrollably vomiting, can't concentrate, and cannot read. This is not a safe condition in which to be providing patient care. Yet American culture is such that we feel we should be working through it no matter how awful we feel. This must change. Humans have limitations, and those limits really need to be respected. If you would like to learn more about migraines, I strongly recommend the book, The Migraine Brain, Your Breakthrough Guide to Fewer Headaches, Better Health, written by Carolyn Bernstein and Elaine McArdle. The book was published in 2008, so it is an older book. Despite that, I still feel that it is the most patient friendly and most comprehensive overview of migraines that is currently in print. The treatment section in the book is outdated, but if you want to learn more about the types and classifications of migraines, this is the book to read. If you are looking for a guide for tracking your symptoms and starting a migraine journal, this is the book to read. If you have just been diagnosed with migraines, this is an excellent place to start to learn about it. If you believe that you might have migraines, this is a great place to explore that possibility. If you're looking for more information and more patient support for the treatment of migraines, there are two great organizations out there that are doing some really good work. The first one is the American Migraine Foundation. Their website is americanmigrainefoundation.org. They have a lot of resources for both patients and providers to get education on what migraines are. Just a great source of information. The National Headache Foundation is also a good resource, and it is headaches.org. It has a lot of information and education for both patients and providers, but it also has a physician provider directory. So if you are looking for someone to either treat or diagnose migraines, this is a website that you can go to and you can look up who is in your area who can provide you that service. So this is a really great resource. So that's about it for my rambling today. Thank you for coming and spending time with me. If you liked the video, please click the like button. It does help. And until we are hanging out again, you guys take care of yourselves, okay? Bye.